Good morning, everyone, and welcome to good afternoon, I should say, and welcome to a special Calhoun Liberty County edition of our COVID-19 panel discussion with medical experts from across the region and featuring your questions. My name is Skip Foster of Skip Foster Consulting. And soon our panel will turn on their video and they will unmute and they will be joining us to have this discussion. You're going to be able to participate in this discussion by submitting questions through the Q&A function on Zoom and through comments on social media. This discussion is being recorded and will be available to be shared and rewatched shortly after we have concluded. Also, this would be a great time to alert your friends to tune in so that they can watch live. We have an amazing panel of experts today joining us to answer your questions about the pandemic, and I'm going to introduce them now. First, we have Rachel Bryant, who is the health officer at the Florida Department of Health in Calhoun and Liberty County. Also, we have Chris Jepson, who is the administrator at Calhoun Liberty Hospital. Dr. Laura Davis is a family medicine physician at TMH Physician Partners Primary Care. Dr. Gerald Skipper is family medicine physician at TMH Physician Partners Primary Care. And finally, Dr. Misbah Faruqi is the internal medicine physician at the Medical Center of Blountstown. All of these people, these fine folks, during this stressful time have taken their time to give you the latest and best information. So let's get right to it. Ms. Bryant, let's start with you. Could you please give us an overview of the situation on the ground in Calhoun and Liberty counties when it comes to positivity rates, mortality, and any other data you would like to share?
Sure. So I would just like to start with just a brief overview of the numbers for actually the month of August to present, to give us an idea of what we're dealing with. So in Calhoun County, for the month of August, we have had 609 cases. That's compared to last year's August of 285. So at the current time, we are projected, if we continue on the current trend, that we will have over twice as many cases in the month of August as we did last year. That same information, just to give you a little glimpse of how this virus is impacting more of the younger people, I pulled the numbers for 0 to 24-year-olds. Last year, there were only 41 cases of 0 to 24. This year to date, there's been 190. So that's approximately 5 times more of 0 to 5 or 0 to 24 in the year. And that's for Calhoun County. Similar cases in Liberty for the month of August. In Liberty County, there's been 370 cases. That's compared to 79 in 2020. And 0 to 24-year-olds, last year in August, there was 18 cases. This year in August to date, there's been 128 cases. So that's a huge jump in the younger population that is having this virus this year. Positivity rate, when we look at Calhoun County, the positivity rate in the last 7 days, the rolling 7 days, is 22.58%. And that's staying a little consistent, maybe drop just a little bit, but it, as we say, it's a rolling number every 7 days. In Liberty County, that positivity percentage is 31.4%. And that's an increase of 5.22 in the last week. So we are seeing those cases. We're seeing lots of cases that we're investigating. One thing, Skip, that I would like to point out is when we look at the 7-day rolling average number of cases. So within every 7 days, we evaluate cases and what the average is. For the last 7 days, in Calhoun County, it has been 24. And if you compare that to August 24th of last year, it was 5 cases. So that's how many we're seeing such a great increase per day of the 7-day rolling average of cases. For that same information for Liberty County, we're seeing 12 to 13. So the exact number is 12.85. So that compared to August 24th of 2020 was 2 cases. So we went from 2 to a rolling average of 12 to 13. So the reason that I bring that up is, we're very concerned about our schools because this is impacting a younger population. And so I wanted to pull some other data just to kind of put it all in perspective. In August, from August 20, last school year, August 2020 to May 2021, the highest number of cases, rolling cases on a 7-day average was 5.71. And that was seen, through, that was the beginning of August. The highest, the whole entire year was on August 8th, and there were 25 cases. Already this year, starting this year, our 7-day rolling average is 24. So we are starting out our school year with what the entire school year last year, we had the highest rolling cases. And in Liberty County, it's very similar. The highest that it was in Liberty County was the week of January of 2021. And at that time, it was 13.85. And already this school year, we've exceeded that with 15 cases on our 7-day rolling average. So we are seeing it impact our schools. Our vaccination rates are continuing to increase. We are seeing an uptick in the people that are interested in the vaccine and getting vaccinated. Currently in Calhoun County, our percentage of eligible population that has been fully vaccinated is 29.2%. So that still leaves 70% people out there that are eligible for the vaccine that need to get it. And then on the same note, it's 29 for Calhoun as well. So that's pretty consistent county to county.
Yeah.
It's just very important that people get vaccinated. When we look at vaccinations, that's our greatest defense right now against this virus, followed by our hand washing and mask and staying 6 feet apart, hand sanitizers, those kinds of things. But, if I can say anything to anyone, get vaccinated. And if you're sick, stay home. Don't send your sick kids to school. Don't come to work sick. Those are things that, we're ready to get back to life in Calhoun and Liberty County, 2 of the greatest places in the state that you could live. We're ready to Friday night, not to have COVID impact our Friday night football games or school teams. Right. And the only way we can do that is really get vaccinated and use those protective measures.
Well, those are great numbers, and we're going to come to vaccines here shortly and answer folks' questions on those. I want to turn to you, Ms. Jepson, and just get an update about, so you've got Calhoun and Liberty both in your name, right? Calhoun Liberty Hospital. So tell us a little bit about what you're seeing with the hospitalizations there, and what kind of strain is it putting on the hospital, and how is it impacting folks who have non-COVID medical issues?
Okay, I would say for us, a lot of it is the sheer volumes. We're probably up 30 to 35% in the patients that we're seeing in our emergency room and in our inpatient areas. With that, we oftentimes don't have enough beds or the right bed to put patients in. So we're holding patients in the ER. The tertiary facilities, the larger facilities that we would normally transfer sicker patients to, we can't necessarily get those patients out. So we're also holding much sicker patients in our hospital. We have, because after the hurricane, we only have one wing for patient care. And we divided that wing into 50-50. It's half COVID and half non-COVID. And so oftentimes that's another issue for us, just being able to accommodate the right patient at the right time with what their needs are. We've even taken patients in the last few months, we've tried to transfer as far as Vanderbilt University or Vanderbilt to get them out of the hospital, to get them the level of care that they needed. And so you can see we're really pushing all the time, trying to get these patients placed where they need to be. As far as staffing, our staff have been sick too. So we're down probably 20% on our volumes there. So you take 20% of your staff out and 30% increase in volumes, it's very difficult for the staff that are remaining. So they're tired.
I bet that's a lot for anybody to handle. So Dr. Skipper, tell us what you're seeing at your clinic.
Well, we are, just like Rachel was saying, the uptick in the amount of positive patients. We're seeing a lot more people come in with COVID symptoms. And it's not just respiratory symptoms. We're seeing a lot more GI symptoms with Delta. So all those folks, when we're seeing them, we're trying to get them tested, have them isolate until their test results are back.
So the GI thing, I haven't heard that as much. Is that an inconvenient symptom, or does it lead to real serious problems like we've heard so much about with people's lungs and stuff like that?
I don't think it is that severe most of the time, but you will see some folks getting dehydrated. Whereas COVID last year with Alpha, most of the symptoms were respiratory related. Now you're seeing both respiratory and GI. You may have some nasal congestion, but not much in the way of cough, but then they have nausea, vomiting, and diarrhea.
Understood. Thank you for clarifying that. So let's just kind of ease into prevention and how folks can manage this at home. Dr. Faruqi, I think we're all familiar now about social distancing and masking. What have we learned about other things that you can do in terms of healthy living and the way people eat? And I know there was a lot of talk early on about certain vitamins and zinc and stuff like that. What are some good practices for folks to in addition to the things that are more commonly known?
So good evening to everyone. Unfortunately, we're facing an unparalleled calamity of the epic proportion right now in the human history of illnesses. As we know that it has engulfed approximately more than 600,000 people just in the United States. 35 million people are being afflicted with this illness so far. But on the other hand, a lot of great mind of our country has been got together and trying to make it easier for the public and to see what guidelines they can establish to make this illness go away from our society. Of course, the prevention is the basic thing, as mask, and the social distancing is still the cornerstone of this whole epidemic. And unfortunately, sometimes it is not practiced the way it should be. Either the mask use is not proper, that we need to educate the people more about that, and social distancing. Maybe it is a fatigue which is happening in the people's mind because it has been more than 1.5 years we are into this epidemic, and the people are getting fatigued, and that can lead to this kind of behavior in which our behavior has changed and our mask policy is not being, of course, being practiced as it should be. Social distancing should be also practiced better. As far as the prevention is concerned, we are a lot of what you call it, stress onto the vitamins, and among these, vitamin D is the major thing which has been studied the most in a randomized controlled trials. Different doses has been suggested. For example, in some one of the major doses, they're suggesting even 4,000 international unit once a day. But I think so 2,000 unit international unit can be used, and it can be effective in preventing the disease process also. Having a better sleep pattern is a good idea. Also, having a healthy lifestyle, exercising in a safe environment is the greatest thing. In terms of sleep, they say 7 hours sleep is the greatest idea behind it. Some people who cannot sleep better, their melatonin, it can be used in a dose of 3 milligram to 5 milligram. in terms of that. And plus omega-3 has been also recommended, but they have not been tried in the randomized trials. Quercetin has been also advocated, but again, it was not in randomized trial, has been not there. Vitamin B complex in some shape or form has been also helpful. Vitamin C has been also helpful in dose of 500 milligram twice a day. But major stress has been the vitamin D, which has some impact on the disease process and in preventing the disease also. So that is what I can see in this era.
And the good news is a lot of those things are good for you, whether you're trying to not get COVID or not, right? I mean, at least my mom tells me vitamin C is something I'm supposed to be taking anyway. So thank you, Dr. Faruqi, for that. Dr. Davis, give us your best description of the difference between the Delta variant and what I'll just call legacy COVID, original COVID, whatever you want to call it, in terms of the patients that you see and how they're affected.
So prior to Delta, a lot of the patients that we would see would come in with what we would call allergy or cold symptoms. They weren't sure if it was just seasonal allergies or from pine trees or what it was, and they had had symptoms for 7 or 10 days, and then they wanted to get tested. With the Delta variant, we're seeing much sicker patients much earlier on. And so they'll start to have severe shortness of breath or chest pain or wheezing, even within a couple of days of contact with a positive case. Prior to Delta, you heard a lot of people talk about loss of taste and loss of smell. And when we heard that in the office, our antennas went up and we knew they were probably going to be positive, but that's not as much with Delta. And so people are getting duped into thinking that, oh, I don't have COVID because I can still taste and smell. And that's just not the case with this variant. And so, like Rachel said, that's why it's important to quarantine as soon as you have any symptoms. Just because you can taste and smell or you don't have diarrhea doesn't mean that you're not trying to fight this virus.
Just to follow up, Dr. Davis, what can people do to manage this at home? So let's say they're not quite sick enough to get admitted, and I imagine as the beds fill up that bar might inch a little higher than it was earlier. What's the best practices for treating COVID at home?
So stay at home. So don't go to the grocery store. Don't go to the pharmacy. If you need something, call for help. You call your provider's office, call your pharmacist. I promise you have people in this community who would help you. But rest, make sure you're staying well hydrated, drinking plenty of fluids, but also walking and exercising. Like Dr. Faruqi said, it's very important to not lay in a bed for multiple days, but to get up and to move and to get fresh air. You can use Mucinex and honey, that kind of stuff for your cough. You can use the vitamins or supplements that Dr. Faruqi talked about a little bit earlier. But the biggest thing is taking care of others and staying away from the population, even if you're not sure if you have it or not. Stay away from people so that you don't try to spread or attempt to spread it.
That's great. Thank you. And by the way, your questions, viewers, and there are many of you, many viewers and many questions, they're pouring in. I've got an initial list I'm going to get through, and then we're going to come to some of yours that are piling up. Dr. Skipper, so we're trying to manage this at home. We're staying away from other people. What triggers, hey, it's time to go to the hospital? Where's the help us with the line of what is a case that can be managed at home versus, hey, it's time to go really get this looked at and taken care of?
If your symptoms are mild, that can be managed at home most of the time. But if you start having more and more respiratory symptoms, difficulty breathing, can't catch your breath, you're getting up, walking to the kitchen to get water or food, and you're out of breath, having to stop and rest, that needs to be evaluated. It would be a great idea for folks, if you're positive for COVID, to get a pulse oximeter so you can monitor your oxygen saturation at home. Unfortunately, they can be a hard thing to find right now, but if you can get one, that would definitely help. But any respiratory difficulty, when you're having the strain, that's it, that's the pulse ox. But if you're having to struggle with your breathing, you need to be evaluated, whether that's in your primary care doctor's office, the emergency room, wherever, and don't wait. One of the biggest things we see is when people wait and they think, oh, I'll get better. I'll probably be better in the morning. Well, oftentimes they may not make it till morning, you know? And one of the other things, like Laura and Dr. Fruki were saying, take your vitamin supplements, you know, move around, stay hydrated. And a lot of folks will have them take a baby aspirin a day to help avoid clots, you know, but that's part of the importance of getting up and moving. One of the things, if you come to the offices, any of our offices, and we test you positive for COVID, one of the things we try to arrange as soon as possible is the monoclonal antibody infusion. You know, when you talk about what can we do for you at the doctor's office? Well, unfortunately, it's not like an ear infection. I get an ear infection, we can give you an antibiotic. You get COVID, there's nothing great we can give you here. It doesn't exist for outpatient treatment. But the monoclonal antibody infusion is one of the main treatments right now. It's one of the best things we have, and it works better if you get it earlier. So if you have symptoms, don't delay getting evaluated.
Good, thank you. Ms. Bryant, so beyond this webinar, in rural counties like these, how do you reach folks? How do you get information in people's hands and make sure they're properly educated?
But you're right. Our counties are extremely spread out. A lot of geographical area there to cover. But here at our health department, we use our mobile unit to go out into the communities, out into the outlying communities to provide vaccinations. We work closely with our school districts to provide. Actually, we've gone on to the school sites and provided vaccinations there for interested. We went to open houses so that when parents or students that were 12 and up wanted the vaccine, we were there ready to give it and the vaccines. We provide a lot. We work with our faith organizations to see if there's churches that are willing or interested in us coming on site and doing vaccination clinics there. We go to our local Piggly Wiggly and Cash Saver parking lots and give drive-through vaccinations. So we do a lot of outreach clinics to try to reach people that can't come to town, because we realize transportation can be an issue for our counties. We also provide weekly updates on in both of our local papers, and we're on the radio once a week. Kelly King, our PIO, is on the radio once a week, giving updates, answering questions. So we try to reach as many people as we can.
That's great. Thank you very much. I'm sorry, go ahead.
One more thing that one thing that Dr. Davis was talking about isolating and staying home, is that I think, I hear a lot of people saying, because we call people to tell them you need to stay home this amount of days. And that's a lot for some people to stay home, because people get isolated. They feel like they don't have anyone. And so what I encourage people to do is, you don't have to completely shut yourself in a closet. You can still call people. You can, use social media as an outlet. Visit in the yard across 6 feet apart, those kinds of things. I think changing our mindset from being socially distant to being physically distant but socially connected is a very good thing for us to embrace, that we can still keep people safe, keep our other loved ones safe and our community safe, but still adhere by our isolation and quarantine guidelines.
Good, thank you. Dr. Skipper, I want to come back to you real quick, because 2 folks have followed up on something that I almost asked and I should have, and that is, what's the number on this little guy that if I'm under it, it should tell me it's time to get some help?
So
people have asked that.
Okay, so ideally you want to keep you in the 90th percentile on room air. So if you're noticing that your O2 sat is getting to 90 or below, you probably need to be getting looked at. Now, if your O2 sat's 93, 94%, but you're struggling to breathe, you need to be looked at. A lot of it is relative. A rough rule of thumb would say if you're 90 or less, probably we need to be looking at you or listening to you. But if you're above that, I don't care if you're 97, 98. If you're struggling, if you're getting up, walking around, and you're having difficulty breathing, someone needs to look at you.
Great. That's perfect. Okay, we're going to turn to vaccines, which is where most of the questions are coming from our viewers. And I'm going to start with Dr. Davis and then go to Dr. Faruqi. Dr. Davis, what can you tell us about the development of these vaccines? Were they rushed? What can you tell us about that?
So 2 of the COVID vaccines were created using a technology called messenger RNA technology. And so this type of technology takes a message into the cells, well, not into the cells, but into the body, and they never even enter the cells. So there is no changing of the DNA, anything. It's kind of like a messenger that shows up and says, hey, you should be on the lookout for this. Within just a few days of getting that vaccine, those messenger RNA are completely gone from your body. What was injected by our office or the health department or anywhere else is completely degraded. So it's not in your body anymore. There is a very stringent process to get FDA approval for a vaccine. And so in the past, whenever a vaccine has been created, there honestly is not a lot of money for vaccine creation. And so the resources were limited. So they would do phase 1 trials. And when they finished phase 1 trials, they'd then start phase 2 trials. When they finished phase 2, they'd start phase 3. But with the pandemic, President Trump gave us billions of dollars to throw at the creation of these vaccines. And so instead of doing phase 1, phase 2, phase 3 in a row, we were able to do multiple phases at the same time. So the actual approval process seemed much quicker than it would have seemed in the past. I would also say that the data behind these vaccines or the technology has been studied since the 70s. So this wasn't a new vaccine that was just thrown together. It was a vaccine that has been worked on and kind of kept in the back burner for such a time as this, so that when we actually needed it, it could be brought up and tested and could be pushed out. I was talking to somebody about this, a patient, and she said, it's kind of like the out the school. You drive by and it's not there, and then you drive by and this big, beautiful new school is there. And you don't even think about the years and years and years of school board meetings and planning and picking out things until it finally happened. And so for most of us, even us in the medical field, it's like, wow, there's a new vaccine. And we forget that there's been decades and decades and decades of hard work to get this to be made.
Thank you very much for that, Dr. Davis. Dr. Faruqi, we're getting a lot of questions about natural immunity. For instance, if I've already had COVID, do I still need to be vaccinated? And if so, how long do I need to wait? And so what can you tell folks about that?
So if you are being contacted with the COVID, the idea that the people will not need vaccine is false. Of course, when you get contacted with the COVID-19, you develop natural immunity, but it will not be long lasting. And if you get vaccinated, the amount of the response or the antibody produced are double the strength of the original just by the contact. So it is a very important thing that, okay, you should get vaccinated despite being that you have been contacted with the disease. Another thing is the time frame, which is being said that the immunity from the contact with the COVID-19 can last for a few months, couple of months, what they say. And the CDC has not recommended any definitive time plan that, okay, that you should wait for a certain amount of period, but you should be asymptomatic after the original COVID-19 symptoms are resolved. After that, maybe it can be a month, it can be 2 months that you can get the vaccination done. So what we can say that from the COVID-19 original impact, the immunity lasts for a few months, not more than that. So that is why you need to definitely get vaccinated as soon as possible, as soon as you are free of the symptoms.
Okay.
So that is the major thing what we can say. There's no guideline that you have to wait for 90 days or something like that.
And thank you, Dr. Faruqi. And Dr. Skipper, does immunity from one strain of COVID transfer to the new strains that come? And is that an argument for vaccines is that they're more generally protective. How does immunity work with these different strains?
Well, the vaccine right now is going to be more protective in regards to Delta. I had COVID last year, and we followed antibodies, measured antibodies for several months afterwards, and we still had antibodies, but the level was starting to drop. So went ahead and got a vaccine. The other thing to think about, and I may be off your question now, but I'm super focused on Delta and these vaccines right now. Delta is so much more intense, the infection. If you had Alpha last year, COVID last year, or pre-Delta, whatever you want to call it, if you were positive, the thought was you'd probably infect maybe 2 other people, maybe 3, maybe 1. With Delta, what they're seeing is 1 positive Delta patient is infecting 8 or more other people around them. So, that you've heard on the news that if you're infected with Delta, you carry up to 1,000 times more virus particles in the nasopharynx. Get the vaccine. That's the best medicine we have against it right now, prevention.
Yeah. Ms. Jepson, what do you require at your hospital in terms of your staff being vaccinated? And if some of them aren't getting it, how does that impact, this is a viewer question, impact the number of beds that are available there?
Well, obviously, we've had 20% of our staff out with COVID, so it does impact. We have not mandated vaccines at this point in time. We do obviously have mandatory masking in all areas, and we do have appropriate PPE for all of our staff.
Mm-hmm. Okay. So we've got some questions here from some folks that are clearly skeptics about the vaccine, and I think it's important to share those and let y'all respond to them. So one of them is, if the odds of dying from COVID are small, why not just let my immune system kick in and then I'll be sick like the normal flu when it's over? So basically, I don't get the flu vaccine. Why do I not need to get the COVID vaccine? Do you want to take that one? I see Dr. Skipper reaching for his mute button. Go ahead.
Okay. So Delta, we're back on Delta because that's what we have right now. So remember, with COVID, up to 30% of people that get infected can have COVID long haul symptoms. And we don't know who those 30% are. And you don't have to have a severe case necessarily to have the long haul symptoms. And those long haul symptoms may be brain fog, muscle fatigue, body aches, myocarditis. Okay. Now, the other thing is, of the people that have it, up to 20% of people that get COVID will have a moderate to severe case of it. And of those percentage, a lot of them are going to be hospitalized, and those are the ones that the higher percentage there's a high likelihood of death, not in everybody, obviously, but a huge percentage that gets moderate to severe wind up being in the hospital. The vaccine doesn't necessarily say you're not going to get COVID. It doesn't do that, but it does. Hopefully what we're seeing is you have less severe cases of COVID. If you look at the hospitals right now, and I'd spoken to somebody at Gulf Coast and Bay a couple of months ago, and most of their admissions were unvaccinated patients, people that hadn't been vaccinated. They hadn't had COVID previously. They got sick with it. They hadn't had their vaccine. They're in the hospital. That's not saying all of them. Certainly there are people that get a vaccine and still get sick pretty moderate to severe. At TMH, the vast majority, I think, I don't know if it was yesterday or the day before, you had 130 plus patients in the hospital with COVID. I think 18 of them had been vaccinated. So roughly 110, 115 were unvaccinated patients. That, to me, that tells you the vaccines help. Is it 100%? Is it a cure? No, but it definitely helps.
Yeah, point of moderator privilege. Another doctor has used the seatbelt example with me, and I actually was on Facebook wearing a seatbelt is no guarantee that you're going to survive a crash. And in fact, in rare cases where you end up underwater, the seatbelt could hurt you more than it helps you. But everybody understands the net benefit of a seatbelt is much greater than not wearing one, right? There's many more times it's gonna help you than hurt you. And so this is a similar thing, right?
Very similar. That's right.
Yeah. So I want to turn to Dr. Davis and ask, well, actually, Ms. Bryant, there was a question specifically for you, and I think it's someone that's trying to reconcile some of the numbers they gave. They were on the DOH site, and it showed a 7-day case number of 167, and I think you shared 285. Can you just clear that up and let people know kind of where to go for the latest data on that? Do you read me, Ms. Bryant? You're still on mute.
So my data comes from CDC, the COVID tracker numbers.
Okay.
So if you refer to the CDC COVID data tracker, then those would be the numbers that I'm referring to.
Okay. And so that's, you would direct people to that data.
You can go to Florida charts. There are pertinent information there, but also the CDC data tracker is another good, reliable source.
And while I've got you, there's a question about, are there rural county grant monies being awarded to promote the vaccine or decrease vaccine hesitancy? I guess that would also be a question for you. Do you know anything about that?
There have been some county monies received, federal dollars received to the counties, and some of that money has been allocated to the health departments for testing, for more promotion of the vaccine, and to help with the hesitancy. So yes.
Great, thank you. Let's come back over here to Dr. Davis. There's a couple questions about, is the vaccine recommended for pregnant women, and also a question about the impact on fertility. Can you address those, please?
Sure. So the vaccine is definitely recommended in pregnancy. It has just recently been approved by the CDC, or recommended by the CDC, but has been approved by the American College of OBGYNs, the infertility organizations, all of them, for many, many months. So it is definitely recommended. They say that, initially there was a big argument about the vaccines were not tested in pregnant women, and they were not, pregnant women were not put in the trials, and that is correct. But there have been tens of thousands of people that have tested since they received the vaccine, have found out that they were pregnant, or they found out that they were pregnant between the two vaccines. And so that was the importance of, when you get your vaccine, you can sign up for the email or the text message that comes to your system or to your phone to keep giving back data. And that's where they're able to get those from. I've had patients that were very scared. One in particular was very scared, still got the vaccine, and she ended up pregnant like 2 weeks later. So there is good data that it is not hurting infertility or causing infertility. It is not harming pregnancies. And I believe it was just this week that they released a lot of data that a lot of these patients ending up in the ICU intubated are actually pregnant women. We know that pregnant women who get influenza are some of the sickest we see, and that same thing is happening with COVID. Women are dying with COVID in pregnancy, and sometimes their babies die as well. And so the vaccine is completely safe in pregnancy.
Thank you. Dr. Faruqi, you hear this is another viewer question. You hear this a lot. I'm young and healthy. I do all the things that Dr. Faruqi was talking about a few minutes ago. I sleep well, I exercise, like mom tells me, I take my vitamin C. I'm thinking of Bryson DeChambeau, the golfer, who has said he's not going to take the vaccine because he's in such good shape. What do you say to those people?
So as you can see that this new Delta virus has afflicted many young people, and the mortality rate has been high. So if you see the hospitalization rate between the age of 20 to 59 has increased dramatically in this wave. as you can see that. So being young, being healthy is not a good argument that they should not get vaccine, because being young and strong cannot protect you from having the seriousness of the illness in terms of COVID-19. So in this, Delta virus has proved that, I think so. And that is a good reason that they should go for this vaccine. If you just see, I can see in the local hospital spread, a lot of the young people has been, that is by me, 20 to 59, hospitalization has increased a lot. So that is why I think so it is mandatory that, okay, the young people should go for that. They should not lose their productive life just because they should not get this vaccine. I think so I will recommend to them even more that, okay, then if they want to have more healthy life, they should get protected themselves just because of this reason, and they can stay away from that. That's the best I can explain. Because the Delta virus has proved this, being young is not a good protection.
Okay. I want to just kind of go around here. To all of you, and I know we've got doctors and different types, we've got administrators, different types of professionals, but I just want to hear from you. What is the, I'm going to give you two choices. The vaccine objection that's the most perplexing and maybe even a little annoying, and then the vaccine objection that's the most difficult one for you to respond to. So you can choose from either one of those, but just I want to get your feedback on these vaccine objections, and I see a hint of a smile on Dr. Davis's face, so I'm going to start with her.
So my, I guess, most frustrating vaccine hesitancy is that, and this was 2 weeks ago, but that it is not FDA approved. And that's fine. But then as soon as they became positive with COVID, they came to me and wanted the infusion, which is also not FDA approved, treatments that are not FDA approved. All of the infusion has the same emergency use authorization as the vaccine did. And so for me, it was difficult to find where that, if you don't want anything that's FDA approved, I completely understand. But then why do you all of a sudden want the treatment that's not FDA approved? And so that was very difficult for me to find the level playing ground, if that makes sense.
Anybody else want to get in on that one? Not everybody has to answer, but I think that's a really good one, Dr. Davis. Dr. Faruqi.
So I mean, some people have no good reasons many a time. That is the most frustrating thing, is this, that they're just adamant that they will not get it. Some people say the government want to control them, and if we try to make them understand that this is the most studied vaccine and try to make them understand, they say, no, this vaccine is not being studied enough to get it injected. But we try to explain to them multiple times, okay, how much best studied these vaccines are, and it is very difficult to do that. But sometimes the behavior is so adamant, in which they will say, no, we do not want to have a vaccine at all. And then looks like there is no end to it, because it will not go anywhere. And I don't want to make them totally hardened, think that they will never get this vaccine. So some people have no reason to do that, just being, I think so, affected by other people, are as a family, they will decide as a family they will not take. So most of them are, as a family, they decide they will not go for the vaccine, and whole family is deprived of this proper care of themselves. So that is the most frustrating thing, I think so. Okay,
great. We're getting some questions, Ms. Bryant, about the boosters and their availability and kind of how, that's actually something I wanted to ask about, is if do unvaccinated people kind of move to the front of the line, or how does that work in terms of when it's time to get a booster?
Well, in regards to boosters, they have yet to be released. What is being given at the current time is a third dose of the whatever original vaccine you received. So if you received 2 doses of your Pfizer, then you can get a third dose of your Pfizer. Same with Moderna.
Let me just interrupt. What's the difference between a third dose and a booster?
It's the same exact thing that you received previously. It'll just help boost your immunity until the booster will be released. We're hoping or hearing that it will be, a booster will be released, within the fall. We haven't, it's like everything else. We really don't have a set date of when a booster will be released. But what we're offering to people that are immunosuppressed or compromised is that you can get a third dose of the two previous that you received, just to help you go carry on and give you additional protection.
Okay. Great. So one of y'all, I can't remember which one, was talking about the monoclonal antibody treatment. How do you get that? Where is it available? Who is eligible? Okay, Dr. Faruqi, how does that work?
So, I mean, the range is quite a bit wide, and for the time being, it is available mostly in our area in the hospital setting, and the hospital has been generous enough to provide it. But I think so there is availability of the subcutaneous infusion also, which is available in many counties, but I do not know whether it is available over here or not, but soon it will be available. So the major criteria is quite a bit liberal. If you just see that BMI of more than 35, diabetes, COPD, CHF, all those people who have these kind of illnesses, immunocompromised, they can get it. The best time is between the 3rd and the 10th day. Earlier the better. Within the first 3 to 5 days, it is the best time, but up to 10 days, we can get this infusion. But right now it is available in the hospital environment. And even if you just see the liberal criteria, if you're hypertension and you have more than age 55, you can get that also. So the criteria is quite a bit liberal and many people qualify, and it is quite a bit effective so far in reducing the hospitalization of the people. So I think so in the coming future, I can foresee that, okay, we'll have more availability of this modality of treatment right now, but we should catch it early and provide it early. And this subcutaneous form of this infusion will definitely increase. And if we can get into the doctor's offices or the pharmacists, that will be the greatest thing to happen.
Okay, great. Dr. Skipper, you're drawing a bit of the short straw here, but we've had quite a few questions on Ivermectin. I know there's a lot of controversy around that. What do you know about that treatment and the research that's been done on it and the effectiveness of it or lack thereof?
So right now there's randomized double-blind controlled trials going on in the US, but they haven't been completed. There are providers that do prescribe it. We don't at our office. I've got something this week, a statement, FDA, European Medical Authority, the World Health Organization, the NIH, and Merck, the makers of ivermectin, do not recommend the use of ivermectin for treatment of COVID. Now, that may change depending on the outcomes of the trials that are going on right now, but that's kind of what we use to gear what we treat folks with.
Can you think of any reason why those organizations would not want people to use an effective treatment?
No, I mean, there's no reason, especially the maker of the product. If they knew that it worked, they would certainly be promoting it, and so would we.
Right.
Now, some of the studies look promising, but until the trials have been completed, it's much like going back to the vaccine argument. The FDA hadn't approved it, but yet so people don't want to take it, but then they want to argue they want ivermectin. Well, that hasn't been approved for it either. So which side of the fence are you on?
Right. Okay. Thank you for that. So still some folks following up on the monoclonal antibodies, wanting to just get a little bit more detail about how many shots are we talking about, and this is not FDA. Where is that on the FDA approval and stuff like that? Dr. Davis, is this something you can chime in on as well?
So it has, the monoclonal antibody treatment has the same emergency use authorization that the vaccines did originally, meaning that they're in the process of working for their approval, but don't have complete FDA approval. The infusion that's at the hospital is an IV that takes, I think, between 45 minutes and an hour. Ms. Jepson may correct me if I'm wrong. But there are certain criteria for meeting that too, besides the ones Dr. Faruqi talked about, in that it is outpatient only. So it's not an inpatient treatment. Your oxygen has to be a certain, level. So if you have it set up at your doctor's office because you qualify and 2 days later you go to the hospital and your oxygen has dropped, those nice ladies there may not give you the infusion because you no longer qualify. And so there are some things like that that have to be done. It's just a one-time treatment. And then once you're done, you're done.
Great. Thank you. Yes,
Hey, could I say,
Dr. Skipper.
Okay, I want to follow up on Dr. Davis and Dr. Faruqi when they're talking about the infusions. Like Dr. Faruqi was saying, the earlier the better. One of the problems we see in our area is so many people have allergies in this time of year, and you're mowing the grass or doing whatever, cleaning your house, whatever. And you start having runny nose, nasal congestion, and you kind of stay at home and maybe you go about your normal business and you just kind of blow off those symptoms, but they gradually get worse and worse. And so, 7, 8 days later, you come to the office and, I've been having stuffy head and my sinuses are killing me. I think it's the normal infection I get every year. But then we test you and you're positive for COVID. Well, now it's Friday and maybe they can't get you in to get the monoclonal antibody infusion until Monday, and your day 10 may be Saturday or Sunday. There are little things like that that we really want to impress upon people. Get tested early. When you start having symptoms, get tested. We swab your nose. They don't go all the way 4 inches up your nostrils now. It's real simple. But if that's the worst thing you have to do, swab you and it's negative, well, okay. You've wasted a little bit of time and we swabbed your nose. But if it's positive and we can get you to the monoclonal antibody infusion faster, most of the time that prevents you from having those severe illnesses requiring hospitalizations.
That's terrific. I'm glad you interjected that, Dr. Skipper. Thank you very much. So look, I want to, first of all, the audience has been fantastic. The questions have been excellent. And I'm going to turn to Ms. Jepson to close us here. And here's what I want to ask you. We've had a number of questions here, a couple questions about the difference between COVID and the flu, and suggesting that maybe there isn't as much difference between those two things. I want you to really, almost pretend like you're one of your ER nurses or medical staff that have dealt with these folks, and just share with people what that difference is and how this, especially the Delta variant, has changed the kind of, aura at your hospital versus what it would have been before the pandemic.
Sure. And I think you've heard most of the panelists say that it's a very unpredictable sort of virus. You don't know exactly how it's going to affect you. You don't know if you're going to have severe lung congestion, if you're going to have just the drippy nose, or if you're going to have the nausea, vomiting, diarrhea. And people do die from COVID. I mean, and our nurses see the same people that they see out in the community every day. We're a small community. And, so it's very difficult because you interact with these people at church or at school or wherever. And I just think it's a completely different. They also worry about, when these people come in, they're taking care of them, or they've got to take it home to my family, my children. And so it's a whole different dynamic than the flu, for sure. I mean, we could wear a mask with the flu. We can get a flu shot and it was pretty simple. This isn't quite that simple.
Well, look, all of you are performing heroically. We appreciate it very much. We appreciate you making this time today. Thank you for the folks that have joined us. And on behalf of this panel, I would simply urge you to please get a vaccination. It is a much lower risk than not getting it. So I think that's the simplest way to put it. Thank you for your time. I hope everybody has a terrific weekend. Please stay healthy and safe. Bye-bye.